The team at Best Practice Software is here to help you prepare and get you started using electronic prescribing. The rollout of eScripts has been a large-scale, national undertaking involving numerous government and regulatory bodies, prescribing vendors and dispensing vendors. The first phase of electronic prescribing will be available in the JSP3 release of BP Premier. This has been accelerated to better support a contactless patient care journey and is especially beneficial for those at risk during the COVID-19 crisis. Electronic prescribing also means reduced transcription errors, a reduced administration burden, fewer lost prescriptions, as well as increased security and convenience for your patients. We're also working towards additional electronic prescribing features in future releases, like integration with our Best Health app. Before you can begin using electronic prescribing in JSP3, you must first download and install a utility from the Best Practice Software website that will enable the eScripts functionality in BP Premier. This additional step has been introduced to ensure that you acknowledge your understanding of the conditions for the use of eScripts in your locality. Please be mindful that even if you can legally use BP Premier eScripts in your state or territory, you may not have any eScripts-enabled pharmacies near your practice. Before you create an eScript for a patient, please ensure that there are local pharmacies that can dispense this type of prescription. When you generate an electronic prescription, a token gets sent to the patient's electronic device via SMS or email, or it can be printed on plain paper. The token displays a unique QR or quick response code on the patient's device, along with some information about the prescribed medicine. This token can then be scanned by the patient's participating pharmacist, which acts as the key to unlock the electronic prescription from an encrypted and secure electronic prescription exchange service, such as eRx. In the first edition of BP Premier eScript functionality, sending an eScript token will not cost your practice any BP Comms credits. Until at least the 30th of September 2020, the initiative is being funded by the Department of Health. Once the Department of Health funding ceases, BP Comms credits will need to be purchased by your practice to SMS eScripts to patients. The cost to your practice for each eScript token sent or resent will be 4 cents via SMS. Once the Best Health app is integrated, it will also be an option to send and resend tokens to patients at a cost of 3 cents per token. As not everyone has a mobile phone or internet access, some of your patients may prefer to take something with them to their chosen eScript-enabled pharmacy. You can print a paper token, which holds all the same encrypted information that the pharmacy can retrieve by the prescription exchange service. No need to change printer settings, a paper token will print straight onto an A4 piece of paper that, unlike a paper prescription, you do not need to sign. You can also still create a normal printed prescription too. It's important to note that you can create either a paper script or an eScript, but not both. It's quick and easy to use electronic prescribing as part of your normal prescribing workflow. Once you've added a drug to prescribe, tick the checkbox next to the drug in the Current Prescriptions panel. Then, select a method for sending the token from the Token drop-down menu. You can select the email or phone number listed in the patient's demographics, or you can send the token to an alternative email address or phone number, or print the token on plain paper. Click the eScript button. If, like in this example, you've prescribed a Schedule 8 drug, you will need to re-enter your BP Premier password. As this eScript is to be sent to a number other than what is in the patient demographic, the alternative phone number can now be entered. A message will pop up confirming when the token has been successfully transmitted. If there has been a problem with the transmission and the eScript wasn't successful, you will have the ability to print a paper prescription. It's always a good idea to have the patient confirm that they've received the token before they end the consultation. Once the eScript has been sent, you can select past prescriptions to resend or cancel an eScript, or to check if the script has been supplied as an eScript or a traditional script. To resend a token, right-click the listed drug and select Resend Token. You will again have the option to send the token to the email or phone number listed in the patient's demographics, to an alternative email address or phone number, or to print the token. To cancel an eScript, right-click the drug and select Cancel eScript. Click Yes on the alert box that appears. You can also use the Past Prescriptions panel to find out if a script has been sent as an eScript or not. There are some key steps your practice will need to take before you can begin using eScripts. Again, it's important to remember that you will need to ensure that there are eScript-enabled pharmacies in your area before you can begin using eScripts. Firstly, if your practice doesn't already have one, you will need to register for a HPIO, or Healthcare Provider Identifier Organisation, and connect to the HI service. Visit the Medicare website for more information. Your healthcare provider identifier organisation number, also known as your HPIO number, will then need to be saved in your practice details in BP Premier. Next, your practice and each individual prescriber will need to register with the ERX Prescription Exchange service. Registration details can be completed via their website, and they can assist you with installing the software. We understand choice is important to our users, so alternative prescription exchange services will be supported in a future release. The third step is to configure your system. You must ensure that health identifier numbers are recorded for all practitioners, as well as their provider, prescriber, and ARPA registration numbers. Your team will also need to ensure your patient's contact details are up to date and their individual healthcare identifier, or IHI number, has been recorded in their demographic. The patient's IHI number will need the status of active and verified to enable the eScript functionality. The IHI can be validated individually in the patient demographic or in bulk for patients in the appointment book. Once your system has been set up and you're ready to go, you should also consider the practice's communication strategy, so staff and patients are brought up to date with electronic prescribing. Lastly, it's a good idea to regularly check the Australian Digital Health Agency website for any new information about electronic prescribing, such as fact sheets and frequently asked questions. The team at Best Practice Software are here to help. For more information about anything to do with electronic prescribing or preparing your practice, head to our knowledge base. Simply click online from the Help menu in BP Premier and search for eScripts to find all relevant materials. Be sure to check out our free masterclass webinar on the JDSP3 release, available on our Vimeo channel, or email us at training@bpsoftware.net to book a fully customizable remote training session with one of our qualified trainers.